Nearly 2,000 med students graduated months early to join the fight against the coronavirus. MSNBC senior national correspondent Chris Jansing spoke with one woman starting her career on the front lines of a pandemic at UMass Memorial Medical Center near Boston.
First day as a doctor.
April 11th, 2020, Dr. Lauren Colwell fast-tracked onto the front lines of a pandemic.
One person from the ward came and who was severely hypoxic and needed urgent intubation.
She's dreamed of being a doctor since she was 5. Dreamed of a graduation like this.
The graduates of the School of Medicine.
Instead, 2 months ahead of schedule, it happened via webcam.
None of us could have imagined how unusual this graduation day would become.
And within days, she's suiting up for the long battle ahead.
It's 8 p.m. and I've been here for 13 hours. And this has been intense, new for me.
They don't teach you this in medical school, how to deal with this emotion and a pandemic. It's not something you test to see if you're able to handle suffering or have people die.
This new test, comforting COVID patients, means staying behind the glass.
I feel like it's the only thing I can do is to wave at them and to just know that someone's watching over them, that they're not alone in that room.
A young woman training to be an eye surgeon, never expecting to see so much death.
I am scared. I'm scared to get infected. I'm scared to infect others. There's moments where I just go into the stairwell and just think, how is this happening? I've learned that I'm only human. My role is to give someone the best chance they can be.
But then sometimes a patient shows remarkable resilience.
Or you're just so thankful that they pulled through and they get to smile at you. They get to talk to you again. And hopefully we'll see them on the other side where we're not wearing our masks anymore.
One day when all those smiles aren't hidden away.
And MSNBC's Chris Jansing joins us now. Chris, I have always wondered what it has to be like for a doctor on that very first day of work. But Dr. Colwell's situation is just incredible to have that day come 2 months early and in the middle of a pandemic. After all that, what did she tell you? Would she do it again?
I just emailed her that question. I mean, because she's finishing up this week and then she's going to go into her, I guess, regular job, which is learning to be an eye surgeon. Look, what she went through, what almost 2,000 others continue to go through is unprecedented in modern medicine. And so much of what these medical students learned has been turned on its head. You know, spend time with the patient, talk to them, sit by their bedside, which they could not do. Many of the hours that she had there were taken up calling family members who wanted to be by the bedside and could not. Often she had to deliver very difficult news. So I did say to her, you know, what, would you do it again? And she said, absolutely. In fact, I'm going to read from her email to me. She said, for me, there was no other choice but to help. One more interesting thing, Allison, during all of this, she was apartment hunting. And she kept getting turned down, and she thinks it's because she was a medical professional. She said, look, I obviously can afford to pay. I had great references, but I think there's so much nervousness out there. I couldn't get a place to live for my residency. She just told me yesterday she did get an apartment.
Great to hear that for her. Just the whole story, Chris, as you said, the situation is just unprecedented. And it just makes you appreciate even more how incredible our doctors and healthcare workers are. She's amazing. Thank you so much.
Yeah.
Yeah. The FBI and DHS are warning that Chinese hackers are targeting U.S. coronavirus research. They say these cyber attacks could jeopardize vaccine progress. NBC News chief foreign correspondent Richard Engel reports.
Allison, this could become another major point of tension between the United States and China, and there have already been several over COVID-19. Today, U.S. cyber defense authorities and the FBI, in a statement, directly accused China of trying to hack into the American healthcare system, hack into research laboratories, hack into the communications of scientists to try to steal their research, steal work that's being done to come up with a drug to lessen the impact of COVID-19 or even a vaccine. And the statement said that these attempts to penetrate communications, to penetrate the computers and steal information are even jeopardizing the programs. And that is a very serious charge, and it is a charge that not only American authorities are making. I spoke with the head of the cybersecurity division of GCHQ, which is the British equivalent of the NSA. And I must say, it's quite rare for people from GCHQ to go on camera, to go on the record. And it shows how seriously here in this country and in the U.S. they're taking this threat.
How is COVID presenting unique challenges?
The overall level of attacks from both nation states and criminals in cyberspace is broadly stable, but they're attacking different targets. So the nation states are moving away from perhaps things like energy companies towards strategic healthcare targets, towards university researchers into COVID vaccines, pharmaceutical companies into our political systems a bit more and how we're dealing with COVID.
The state actors, are they attacking healthcare systems to steal information or to harm them and hobble societies of their adversaries' enemies?
I've not seen attempts to disrupt healthcare, but we are seeing attacks on some university research into COVID-related matters, and we're seeing interest in strategic health bodies and so forth. So I think it is more the risk around how our response to COVID is working. The race is on to get vaccines. The race is on to get better data. People want to know what other countries are doing in this crisis. That's the sort of thing we're seeing from the state actors.
That British official didn't directly blame China. He said that there are a variety of nations that are trying to do this kind of theft by hacking, particularly in regards to COVID-19. But when I pressed him on China, he said that the U.S. and British intelligence share the same assessment of the cyber threat. China denies these allegations completely. Allison?
Austria is one of the first countries in Europe to reopen. NBC News senior international correspondent Keir Simmons spoke exclusively with the country's chancellor about how Austria could serve as a model for the United States.
Hey, Alison, the population of Austria is around the same size as New York City. Austria, though, get this, has had just over 600 deaths from the coronavirus. And it isn't because, of course, the Austrian Alps are very different from Manhattan, because Austria did have real challenges. There was a period where a ski town in Austria was spreading infections and people going from vacations and taking those infections around the world. But Austria locked down very heavily, including having medical teams able to go to people and test them immediately if they showed symptoms, including mandating that people wore masks. And now, speaking to the leader of Austria in this exclusive interview, you're really struck by how respectful the Austrians are being of the coronavirus, working to its timeline. So opening up a little bit, waiting 2 weeks, which is how long it takes for symptoms to appear, then opening up a little bit more. And of course, Alison, central to the way they are unlocking the Austrian lockdown is testing.
The White House is watching Austria to see how you're opening up. Austria is about the same size as New York in population. What's the key thing that you have done that America could learn from?
Well, I don't think that somebody has to learn from us, but what we tried is to react very tough and earlier than others. And I think this lockdown worked. The numbers decreased in our country. And beside that, we have three quite important things. First is that people respect our social distancing rules. Second point is that people have to wear masks in shops, for example, or public transportations. And, of course, we avoid big gatherings. And I think these three measures are quite effective.
you're hoping to reopen tourism. That's going to be a challenge, isn't it?
Well, it's a challenge, but we are well prepared. We will do a lot of testing. We start to open the hotels in Austria at the end of May.
So a plan to open up to some countries depending on the level of infections. And I think that really prompts a conversation, Alison, that we really maybe aren't having enough of, which is what does air travel look like and what kind of tensions does the coronavirus create? Because, of course, if you have some countries that are agreeing to have people from other countries come to them, if they have controlled infections, you're going to get big divisions around the world and huge tensions. And one of the big questions for America, of course, is if the current policy in the US isn't controlling infections, will other countries close their borders? Very difficult, because America is the biggest economy in the world. It's just a picture, Alison, of the kinds of tensions, controversy and issues internationally that I think we're going to face in the months and years to come. Alison?
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.